Hello and welcome to the Marathon series where we are discussing about your heart health. Heart disease in India has almost doubled since 1990s, now causing 1 in 4 deaths. Heart disease is also no longer just an issue for the elderly. It's affecting men, women and children across the country and at an alarming rate. When the heart is affected, the risks are obviously deadly, but these are not totally irreversible. Small lifestyle changes today can protect the heart. Today, we are focusing on advanced therapy for mitral heart valve disease. And I have a very renowned panel of doctors to discuss this subject. I have with me Dr. Praveen Chandra, Chairman, Division of the Interventional Cardiology at Medanta. And I also have with me Dr. Sengottuvelu G, Interventional Cardiologist and Clinical Lead at the Apollo Group of Hospitals based in Chennai. A very warm welcome to you both on the panel, sir.
Really happy to be here in this program.
So I would like to start with Dr. Praveen Chandra. Dr. Chandra, is it right that India is becoming the world capital for cardiovascular diseases?
Yes, this is a very, sad news, but it is very important to understand that in India, a large number of people are suffering from heart diseases. And since our population is so much that now we have become the one of the largest number of patients of heart in the entire world. So you can imagine we are really have to grapple with the situation and try to handle it in such a way that we make our population healthier and they can lead a better life.
Dr. Sengottuvelu, I would come to you now. Heart diseases are affecting not only the elderly, but also a lot of young people. We've seen a lot of young deaths post-COVID. What are the common heart valves diseases which you come across these days?
Yeah, so there are different types of heart diseases, and one is the blood vessel disease, which commonly affects young people or even elderly people, causing a heart attack. That's what we see. The other major issue is a valve disease, and valve disease can occur at any age group, but the most commonly what we see is degenerative or related to old age. This happens as we are now seeing an aging population in our country. People are living to 70s, 80s, and even 90s. We are seeing because the wear and tear, continuous use of valve opening and closing over many years has caused the valve to degenerate, which means deposition of calcium, thickening, and the valve fails to move well, resulting in narrowing of the valve. So this can lead to the blood flow coming out of the valve to be reduced, and there are many types, 4 types of problems can occur, but the major heart valves are aortic, mitral, 2 main valves on the left side. There are 2 other valves, the pulmonary and the tricuspid valve on the right side. The major valve is the aortic valve, which lets blood from the heart to the rest of the body. When this aortic valve starts narrowing, then once it reaches a point where it has become critical or severe narrowing, we call it as stenosis, that's when patient starts developing symptoms.
So, for the common person who's seeing this discussion at this time, could you help us understand how these heart valves function? What are they exactly, and why are these valves so important in our heart?
The heart has got a very, very important function, and it works, as you know, it works 24/7. Basically, what happens is the blood from the entire body comes back to the heart through vein to the right side of the heart. And from there, it goes to the lungs and gets oxygenated blood goes to the lungs, and the blood comes back to the left side of the heart. So for the movement of the blood effectively within the right system, there are 2 valves which allow blood to go in one direction. The blood doesn't leak back. So when the blood comes from the entire body, it goes through this valve called tricuspid valve and the pulmonary valve, and then goes into the lungs. And then the blood gets oxygenated and receives oxygen from the lungs. And once the oxygen-rich blood comes back to the heart again, to a chamber called left atrium. And from left atrium, the heart blood goes into the left ventricle. Left ventricle is a main heart chamber, which is the most powerful chamber, which helps to pump blood to the rest of the body. The valve, which is between the left atrium and the left ventricle, is called the mitral valve. and the other valve which goes from the left ventricle to the aorta where it supplies to the rest of the body is known as the aortic valve. So the major two valves which are on the left side of the heart, aortic and mitral, and both these valves can give rise to problem in elderly due to aging and many other causes, including some birth defects which can be asymptomatic during their entire lifetime and sometimes progress and cause symptoms later in 50s or 60s or in their lifetime.
So, Dr. Chandra, we've heard some chatter about the aortic valves, but not so much about the mitral valves, as Dr. Sengottuvelu just mentioned. How crucial is it to focus on the mitral valve diseases?
Okay, so let me, first, make everybody understand that what exactly it means. In fact, the heart has two main valves, two main gates. From one, the blood comes, and the other, the blood goes. So, the aortic valve is the valve which is the gate of the heart through which the blood goes inside the entire body. And when it becomes diseased, or the blood flow is obstructed, then we have to put a valve inside, a new valve. Surgery has to be done. Or nowadays, we do it without surgery, known as TAVI procedure, which is very effective. And in those patients where the risk of surgery is high or where the surgery cannot be done, we do a TAVI procedure. Then comes the second valve, which is the most important gate of the heart through which the blood comes inside, is known as the mitral valve. The name is mitral gate. Now, through this, when this becomes leaking, or it becomes narrow, then we have to treat it. Many times, when this valve starts leaking, we have only option was to do a surgery. But now, today, we have a new option where we can repair the valve without even opening it, without even doing any surgery. It is done through an injection, and this process is known as mitral tear treatment, where no surgery is done, there is no cut, there is no stitch, everything is done under just an injection. So this is the benefit of giving this treatment to the patient, that a big surgery is avoided.
Dr. Sengottuvelu, we often hear this word, the leaky valve. What does it exactly mean? What is the meaning of stenosis or valve calcification? And what are the most common problems that occur with mitral valve?
Okay, let me tell you, the people should sometimes clearly know what is the valve and a blood vessel. Blood vessel is a vessel which supplies blood to the muscle, and that's a different condition. What we are talking about is a valve within the heart chamber. This valve has got leaflets, which can be either two or sometimes three in aortic valve and two in mitral valve. So what we mean by leaky valve is the blood, as I told you, blood should flow in one direction. That is from the left atrium to the left ventricle. Instead of that, the blood goes back from left ventricle back into the left atrium from where it came in a reverse direction. That is called a leaky valve, because a valve is not able to only push the blood forward, but it's leaking, and since the blood is leaking back. So that is a problem, because as the blood is trying to go out of the heart, the blood is again coming back. So the function of the heart increases and the heart starts becoming bigger and bigger as the blood volume increases with the heart. So leaky valve is a problem. It can happen in both mitral and tricuspid, and also the tricuspid or in the aortic valve. The mitral valve leak is a significant problem. We also call it as mitral regurgitation. So if the leak or the severity of the leak increases and reaches a certain level, then the patient starts developing symptoms like breathlessness, or sometimes even difficulty in walking and all that. Once they develop these symptoms, the heart pumping also can sometimes come down. And in that situation, the valve leaking has to be corrected.
Taking the subject of leaky valves forward, Dr. Chandra, are these leaky valves mainly related to aging, or they can occur due to some other disease as well? Your thoughts?
Yeah, the leaky valves, as I said, that primarily they become diseased because of the aging process, especially in the elderly people. But in those people where a heart attack has happened, or the heart has become already very weak because of the heart weakness, then the valve starts leaking. that is the time when we start thinking of repairing it through the mitral tear treatment without any surgery. The second way by which the valve gets diseased is in the younger age group, and this is known as rheumatic heart problem, where first we treat with medicines, and if it doesn't work, then we treat with surgery.
Dr. Sengottuvelu, what are the reasons behind a leaky mitral valve and what type of mitral diseases are commonly seen these days?
So mitral leak can happen either because of sometimes by birth defect or it can be occurred later in life. The birth defects can be very mild at birth to start with, and as we age, it can progress, and the valve leak can progress, and then symptoms can come, and we need to treat it later in life. That's we call it as mitral valve prolapse or degenerative disease. Sometimes there is excess tissue, like in Barlow's disease, related to a birth defect or congenital genetic defect can cause this. More commonly, the mitral valve leak can happen after a heart attack. It can happen in elderly people or even as they degenerate and as they old, there can be a flail valve, the chordae or what the supporting structure of the valve can rupture, and that can cause a severe leak. The valve is a complex structure supported by many tissue. And if there is a damage to the tissue because of the heart attack, the valve can start leaking. So even sometimes the heart attack happens, the heart size can become very big. And as the heart becomes big, the valve will not be able to support the blood only in the forward flow and it can start leaking. So there are a number of causes, and what we call nowadays is we call it a secondary MR, heart valve leaking secondary to a heart attack, which is a common problem where surgery doesn't have a big role, and these patients are often kept on just on medicines, and they have a lot of issues if the valve leak persists in the patient who has already a weak or a very poor pumping, has poor pumping function.
So this seems like the leaky valve is quite a serious thing. Dr. Chandra, what are the symptoms that a common patient should watch out for, in your opinion?
Yeah, the leaky valves, as I said, that primarily they become diseased because of the aging process, especially in the elderly people. But in those people where a heart attack has happened or the heart has become already very weak because of the heart weakness, then the valve starts leaking. That is the time when we start thinking of repairing it through the mitral tear treatment without any surgery. The second way by which the valve gets diseased is in the younger age group, and this is known as rheumatic heart problem, where first we treat with medicines, and if it doesn't work, then we treat with surgery.
For most cardiovascular diseases, chest pain, breathlessness, and fatigue are common symptoms. Are there any specific symptoms that patients with mitral valve disease should particularly watch out for, Dr. Sengottuvelu?
So the mitral valve patients can have different kinds of symptoms. As you said, breathlessness is a common symptom. Sometimes they can have a swelling of the feet. Sometimes they can have the sudden onset of breathlessness, particularly in the midnight, waking up with the midnight with a lot of breathing difficulty. Sometimes the breathlessness can be so severe because of fluid collection in the lung, and which may require an emergency hospital admission and care. So the presentations can differ depending on the severity and the age of the patient.
So now let's focus on the treatment of the leaky valve. And I want to come to Dr. Chandra for this. What is the treatment for a leaky valve, Dr. Chandra?
As I said, for the leaky valves, the treatment first is, of course, giving medicines. But when the medicines start failing and the patient symptoms are not getting better, then today we start thinking of this new treatment option without surgery, where we do a mitral tear treatment. But in those patients where surgery is possible or surgery can be done, then we do surgical treatment of this leaky mitral valve.
Taking this forward, Dr. Sengottuvelu, can medicines help in treating leaky valves? And for a layman, how exactly do these medicines work?
Of course, the medicines really work as a first-line therapy for leaky valves. As I mentioned, the leaky valves progress very gradually, starts from mild, then becomes moderate, and becomes severe. So definitely medicines will help to reduce the progression of the leak. by
Okay.
reducing the blood pressure of the patient, giving medicines to improve the pumping function. The leaky valve the leak can be reduced, and hence, the surgery or the procedure can be prolonged to a later day as much as possible. So the medicines help by reducing the pressure, and hence when the pressure is low, the leak back will be reduced, and the forward flow will be much better when the blood pressure is less, so the blood can move forward. So when the medical treatment fails, then we think of other procedures like tear therapy, where we do a transcatheter edge-to-edge repair or surgery, as was mentioned now.
When we talk about the advanced treatments available in heart care today for the leaky valves and the mitral valve problems, apart from medication, what are the new advancements that are available for this issue, Dr.
Yeah,
Chandra?
as I already told you, the advancement which is now today, which is available, is that without surgery, we can treat many of these patients where mitral repair can be done without any operation. It's all remote controlled. And
Right.
we do this through a injection, something like angioplasty only, and it takes about 1 hour to do it. And the next day, the patient can go home, walk around, do everything, whatever he wants. He can eat, drink. Yes.
Dr. Chandra, you also mentioned about tear a little while back. So, what is this treatment? If you could shed more light on this,
Yeah.
how is transcatheter edge-to-edge repair or tear performed?
Yeah, so this, as I was mentioning, the transcatheter edge-to-edge repair is done through the small tubes which go inside the heart, and it is done without surgery, and it takes about 1 hour to do this, and typically 1 or 2 clips we put to stop the leakage, and that is all. So it's done in a hospital where everything should be available, like a cardiac cath lab, ecosystem, everything, and then it is much easier to do it. So we have been doing this treatment for the last now maybe 7, 8 years, and we have seen a lot of progress and lot of relief to the patients when they get this done.
Dr. Sengottuvelu, can you help us understand how is tear treatment different from the conventional surgery?
Tear is actually, as I mentioned, is transcatheter edge-to-edge repair.
Yeah.
Conventionally, valve leaks are being treated by surgery, which is open heart surgery, with a valve is sometimes repaired or sometimes replaced. We always believe repair is much better than replacement. The transcatheter H2 therapy was actually initiated by a surgical procedure called Alferes procedure, where the center part of the valve is stitched together, creating the orifice of the valve is made as two orifices. So thereby the leak is reduced. So now elegantly this procedure has been moved to a transcatheter procedure, which is very minimally invasive procedure, introduced through the groin, through the vein, and introduced from the right side of the heart to the left side of the heart into the mitral valve, where the valve is leaking, and the clip can be placed within the valve leaflets, thereby exactly looking at the echocardiogram, used what we call as trans-esophageal echocardiogram, and the clip can be placed exactly at the leaking valve, and the leak can be reduced, completely controlled, using a transcatheter procedure, avoiding a major heart surgery.
So, continuing this further, Dr. Sengottuvelu, how effective is tear in improving patient outcomes and patient recovery?
Several studies have shown that tear therapy is one of the significant advantages in patients who have high risk for open heart surgery in degenerative mitral leak, which means the patients who have defective valves. In patients who have secondary mitral leak, which is related to heart attack, these patients who have poor heart function, those people, they have shown that the surgical options is limited, because surgery carries a very high risk and there is no benefit. The only option is medication. And now with the availability of this tear therapy, these patients have significant advantages. And in our own experience, as well as the evidence is very clear that tear therapy helps these patients to reduce hospitalizations and improve their quality of life, as well as their improvement in symptoms.
Dr. Chandra, as you mentioned about the benefits of this treatment, the tier treatment, is it alone sufficient? And I also want you to tell us more about the cost of this treatment. Is it expensive? And what steps are being taken by the Indian medical device industry to make it more affordable for patients?
So, this treatment was actually very expensive to start with. And the American clips which we were using earlier, they to the patient, the whole cost was coming to about 25 to 30 lakhs. But now, with the use of the Indian indigenization and the Make in India clips, the cost has come to almost half. It is about 15 20 lakhs only.
I think that's a good point to conclude this discussion, that this treatment, which is very, very less invasive and gives a very great recovery time, is quite affordable now. And advancements are happening in cardiac surgeries and different heart treatments. So with that, I would like to conclude this discussion. And I would also like to thank you and Dr. Sengottuvelu for taking your precious time out for sharing with us and giving this very important information for the benefit of our viewers.